This video will provide an overview of lymphedema. The lymphatic system is a network of vessels and nodes throughout the body. The main function of the lymphatic system is to maintain fluid balance within the body, working in combination with the blood or circulatory system. Fluid moves through our vessels and then reaches the lymph nodes where they filter the fluid and drain excess back to the heart, and any that is not required by the body is removed. The other main function of the lymphatic system is to help fight infection, so it acts as part of our immune system. A chronic edema is a swelling of more than 3 months' duration that does not reduce in elevation. A chronic edema that does not reduce overnight is likely to be lymphatic in origin, and therefore an imbalance between capillary filtration and lymphatic drainage exists. Lymphedema is an abnormal swelling that can occur anywhere in the body and is mostly seen in the arms, legs, breast, pelvic region or head and neck. It may be caused by a primary or secondary disturbance to the lymphatic system. A primary lymphedema is failure in the development of the lymphatic system. These symptoms may not occur until later in life. There is a genetic predisposition, and ongoing research to identify genes is taking place. A primary lymphedema may present during times of hormonal changes, such as puberty, pregnancy, or menopause. It may also present following a traumatic injury. Although the edema can affect both sides, often primary lymphedema is unilateral in presentation. In these photographs, you can see how a primary lymphedema may present itself. The first photograph shows a swelling in and around the left foot and ankle area, whereas the other photograph on the right shows a primary lymphedema along the whole length of the left limb. Secondary lymphedema can present whenever there is a failure to either the lymphatic or the circulatory system. In venous insufficiency, the circulatory system is compromised, and this may be as a result of leg ulcers, varicose veins, or a deep venous thrombosis. In these cases, the blood system or circulatory system is working inefficiently and causing the lymphatic system to overload. This imbalance causes fluid to collect within the tissue and secondary lymphedema to develop. In terms of cancer-related secondary lymphedema, the surgery where lymph node removal may have occurred causes a disruption to the lymphatic pathway or network, and this can give potential rise to swelling developing within the tissue. Chemotherapy and radiotherapy can cause scarring or damage to the vessels themselves, which in turn can reduce the network system and the efficiency of transport. Medication sometimes can be a cause of secondary lymphedema to develop, and we know that with patients who have already established lymphedema, certainly lymphedema can worsen if they are on steroids or calcium channel blockers. So in this respect, it's sometimes useful to review the medication and seek an alternative if appropriate. People that have recurrent infections can go on to develop secondary lymphedema. Our lymphatic system acts as part of our immune system to help fight infection. And each time we have an infection, it can cause slight damage to that lymphatic network or transport system. Therefore, those people that have recurrent infections get continued damage, which then causes the system to work less efficiently. Traumatic injury can also damage the lymphatic system because sometimes some of the pathways or vessels that lie closer to the skin can be damaged and reduce the efficiency of the network system. Intravenous drug abuse, again, disrupting the circulatory system. Heart failure is another cause of the lymphatic system to become damaged. And this time, patients will present with soft pitting swelling in the lower legs, which can extend up to the sacral area. Most of the time, heart failure can be managed by medication, and in some cases, light compression therapy is indicated, although this will require specialist assessment and advice. Superior vena cava obstruction is another cause of secondary lymphedema to develop in the chest wall and affected arm due to constriction of the pathways in that area. In palliative patients, low albumin levels can cause swelling to develop, and this often presents as soft pitting spongy edema in the affected areas. Obesity is another cause of secondary lymphedema, and this is because the excess abdominal fluid or weight can cause constriction on the pelvic and groin nodes, which will disrupt the drainage pathways in this area and in the lower legs. Immobility or leading a sedentary lifestyle can also cause secondary lymphedema to develop because our lymph pathways are enhanced or promoted by movement, and therefore if we're not moving, our lymph vessels are not being encouraged to drain the fluid out of that affected area. Filariasis is a parasite that can infect a person and cause secondary lymphedema to develop. These pictures show the different clinical presentations of secondary lymphedema, each one slightly different in its presentation, but all presenting with an abnormal swelling in the affected areas. Early signs of lymphedema are sometimes quite difficult to detect. Very often people will describe a mild swelling in the affected area with possible pitting of tissues. Pitting is where you press into the tissue for up to about a minute, and when the pressure is removed, it leaves an indentation in the skin or tissue. Usually patients will describe a stiffness, fullness or heaviness in the arm that wasn't present before, or potentially an aching, and the clothing, footwear or jewellery may feel tighter. In terms of developing or progressing lymphedema, there are certain changes that are associated. Skin changes are one of the factors, and with this in mind, we often see patients with papillomatosis or cobblestoning. As you can see in this picture, lumps and bumps start to appear on the surface of the skin. Tissue changes such as staining or fibrosis or firm tissue start to develop, whereby the tissue may have been softer and more supple previously. Shape distortion is another clinical sign, and as you can see from the picture, skin folds can start to develop in more chronic conditions. With this in mind, there's usually an associated reduced function, and possibly recurrent cellulitis starts to develop because of those firm fibrotic tissues. Chronic inflammation can also be seen because of the congestion of the tissues. And in some cases, we see lymphorrhea or leakage of fluid through the surface of the skin. It's important to note that lymphedema may be uncomfortable, but it's rarely painful. And it is essential that other differential diagnoses are excluded prior to a diagnosis of lymphedema. Lymphedema can't be cured, but it can be controlled, and managing lymphedema is really important. Looking after your skin, keeping it well hydrated and intact is vital. It is important to treat any grazes, cuts, fungal infections appropriately, therefore minimising any risk of infection. Keeping active, either through daily activity or specific exercise programs, is also important. This will promote lymph drainage and optimise control of the affected area. Positioning is really important too, so in terms of arms, making sure they're well supported on a cushion or pillow, elevating if necessary, and with legs ensuring elevation and reclining when able. The mainstay of managing lymphedema is the daily use of compression hosiery and/or supportive garments. These will be prescribed by your lymphedema specialist. Looking after your weight is really important too, because we see the correlation between weight gain and lymphedema being exacerbated. Maintaining a healthy weight and eating a well-balanced diet will help with this. Obviously, if you have symptoms suggestive of lymphedema developing, it is really important to speak with your GP initially, and then if appropriate, you will be referred into our service. For those of you who already have established lymphedema but are concerned about your condition or are simply seeking more advice or support, again, please do get in touch. I hope this video has been helpful. Please remember we are always available for advice and support if required. Thank you.